I was first introduced to scanners in late 2018, early 2019, and we've used different scanners up to this point. During my postgraduate studies, I compared different digital scanners versus a conventional impression, and this was when used for a single crown and multiple crowns. For the conventional impression, we used the polyether, which is a very highly accurate impression material. Why we are moving from conventional is because sometimes we are sending the work to faraway labs, and we also know that conventional impressions are comfortable to the patients, especially for patients with high gag reflex. Both of them, the results showed that they were accurate and they were predictable. They could be used predictably for impression as impression taking methods. But the challenge with the digital scanners was on the long span units, where we had a 3-unit fixed partial prosthesis. We found out that the conventional impression material was still doing better than the intraoral scanners, and this could be attributed to the fact that it's difficult to capture edentulous areas. And I think for that case, that's where the iTero Lumina comes in, because it has improved capture of the soft tissues in between. So I've had like 3 or 4 or 5 scanners in my practice, but I was still looking for that scanner that can capture soft tissues properly, especially when I'm doing the full arch cases, and then also for orthodontic purposes. With the iTero Lumina, you're able to have a predictability of the outcome with the Invisalign outcome simulator, where you're able to picture the restorative bit, like once the patient has had treatment using restorations like crowns or veneers, how they would look like. And then the other thing why I needed a different scanner is because, as from my study, as you've seen, that there's challenge in capturing the soft tissue areas and deep undercuts when doing multiple restorations. So in this case, I needed a scan that's more accurate, especially when capturing edentulous areas and also when doing full arch cases. So iTero Lumina scanner has many different features that are really good. The other advantage of the iTero Lumina is the scanning speed. Previously, the drawback with the scanners that we've had before, you find that you're scanning and then the scanner hangs. I think you're able to scan within a timeline of less than 5 minutes, and this has greatly improved the outcome of my cases, and even it's more comfortable to the patients. Then the other feature that I love about iTero Lumina is the fact that the images that are captured, they're almost similar to the true clinical picture of the patient. So this has improved the uptake of treatment for patients, because once a patient sees their scan and their teeth in real life, how they look on a photo, sometimes they'll pick some stains and somebody will look, oh yeah, I need cleaning, because you've seen your teeth on a 3D capture image that looks exactly how the situation is on the map. And that has also improved the clinician's uptake on treatment, because you're able to see where the margins are, and you're able to audit your work because you can see exactly how the margin is, especially in areas where you cannot see with the dental mirror. And then also you're able to see deep undercuts and at the back. Another feature for iTero Lumina that I think has been a game changer is the size of the head. The wand is very small and very light. That's better for the clinician and also for the patient, because this increases comfort, and this goes in both ways, for the clinician and for the patient. What else I was happy with was the fact that I could not send shoddy work to the lab, because this scanner will upload your work to a cloud, which I think is powered by artificial intelligence, where they will pick if the scan has any bubble, if it has any default margins, or it has breakages in the scan. So the work will not be sent to the lab unless it's really, really accurate. And this has improved the fit of the final restorative work that I'll do. I think that's really a game changer, because it's like having somebody else audit your work, having somebody else do a mark of quality assurance, in the sense that at the end of it all, you as a clinician, you'll give a good job, and also the patient will get a good job.